Thank you, Mr. Baker. First to Mr. Antos, Ms. Rivelin. Medicare is so important. It's in deep trouble. Lawmakers like to bury their head in the sands on these tough issues. How important is it that we act this year to either save Medicare for the long term or to take meaningful steps to extending its life, for example, another 20 years or more? Mr. Antos, Ms. Rivelin? But act now.
Acting now is a critical matter. Congress has had plenty of opportunity to take appropriate actions over many, many years. But in fact, we still face the problems that the fiscal problems and the risk to the Medicare program.
No. I got a couple more questions for you. So
okay.
Your point is act now.
Act now, but act responsibly.
Got it, Ms. Rivelin.
I would say act now, but for the principal reason that you can use Medicare to reform the whole system.
Yeah. Do you see, as you look at these issues in the President's policies in his budget, income-related premiums for Medicare Parts B and D, the Part D deductible, establishing home health copay, President has suggested this begin 4 years now, 2017. Ms. Rivelin, do you see any reason we should wait that long?
I don't think you need to wait till 2017. You need a little time to get them in place and set them up so it can't be 2014. I think we suggested 2016 as a reasonable year, but again, I wouldn't do these in isolation, do them as a package.
Got it. Makes sense. Mr. Antos, you emphasize broader forms of combining Medicare Parts A and B. This is an important topic the subcommittee has been looking at and will continue to explore. Would you consider the policies we're discussing today to be smaller reforms on the pathway to perhaps bigger ones?
Well, they could be on the pathway to a discussion about combining A and B and more sensible reforms of Medicare. But these specific proposals, I don't think, take us in that direction. They are simply budget cuts.
Got it. Ms. Rivelin, you and Mr. Antos, you both recommended establishing a home health copay so that patients determine the value of those services that is being provided to them. Some critics have warned it would deter many vulnerable Medicare beneficiaries from accessing needed care, maybe increase returning to hospitals. Can you respond to those criticisms?
Well, certainly the President's proposal follows the Medicare Payment Advisory Commission's precaution and restricts this to episodes that have at least 5 visits and are not preceded by an inpatient stay.
So you're not coming from the hospital?
You're not coming from the hospital. Nonetheless, this is a serious matter, and the problem with a lot of Medicare policy is that it is very heavy-handed. We need to have a more subtle policy, or we need to have a better management of patient care.
Should it be adjusted to the income of the Medicare senior?
We certainly should recognize the extra burden that this is going to cause on the minority of patients who don't have the money.
Ms. Rivelin, your thoughts?
Home health care is liable to abuse, and I think that some cost sharing is appropriate. In our plan, we actually help the lower income beneficiaries cope with total cost sharing, including any new cost sharing. So it wouldn't be subject to that criticism.
Yeah. In your belief, as we're looking at value over volume, is Washington the best one to determine what that value of service is, or are patients actually using them, who have some role in some cost sharing, small or large, according to ability to pay? Is that where we see value more likely to be determined?
Well, when we talk about value and quality, we envision a set of measures that will eventually govern the reimbursement as we get more experience with them. I don't think you entirely rely on patients, as Dr. McDermott has suggested, to sort out what is quality. The point of cost sharing is to give patients some reason to stop and think, unless they're very low income, about whether they need to go.
That makes sense. Mr. Baker, I just want to understand, you absolutely reject the President's proposals to begin some of these reforms of Medicare?
Yes, we think that the cost sharing, as said, is a blunt instrument and one that would visit some harm on beneficiaries.
Okay. Thank you, Mr. McDermott.